Good afternoon, everyone. I want to welcome you to another installment of a virtual town hall, this time with a focus on lung cancer. I'm Sarah Loudon from Total Health Conferencing, and I'll be your moderator for the next few hours as we get to have deep and really encouraging conversations with our panel. As usual, we will start with a discussion with advocacy organizations. We'll then move into an interview with medical experts in the area of lung cancer. We'll have a great opportunity to talk to an industry partner and hear all about how the organization is committed to advancing in medicine at this time. And then we will round it out with a patient testimonial that I'm sure will resonate with many of you watching. As always, we'll end with questions and answers. So please, all during this time, feel free to send in questions. If you're registered, if you're joining us on Facebook Live, please post the questions in the dialogue box, and we will make sure that we address. So I just want to give a quick introduction of who will be joining us today, and then we'll get right into our conversation with advocacy. So we're honored to have both the American Lung Association, represented by the National Assistant Vice President of Patient Engagement, Annette Iyer, and LUNGivity, and we're joined by the VP of Survivorship, Katie Brown. We also are working in collaboration with Inspire, and I'll tell you a little bit more about them as we get into advocacy. Then we'll transition to interviews with medical leaders, where we have Martin Dietrich from Florida Cancer Specialists and Research Institute in Orlando, Florida, Shema Kazmi from Cancer Treatment Centers of America in Philadelphia, and Rabi Salgia from the City of Hope in California. So I look forward to talking with the doctors about lung cancer, COVID-19, and a little bit about how practice has changed. We will then be talking with Pfizer about how the organization is committed to enhancing medical services at this time. And we'll end with Randy, a story that is sure to inspire us all. So I'll ask my team to allow me, Annette, and Katie to start chatting about advocacy. Okay, welcome, ladies. Thank you for being here on a Saturday afternoon. I'm very excited to have both of you and to share a little bit about Inspire. So I think let's kind of just jump right in. I'd like to start with, just so that we can kind of contextualize who we're talking to, I'd like to start with each one of you introducing yourself, the organization, and really the overarching mission in a few minutes, as we'll get deeper into the conversation as we go on. So Annette, I'm going to start with you. If you tell us a little bit about yourself, your role, and the organization.
Thank you, Sarah, and thank you for inviting and making American Lung Association a part of this critical conversation that we're having right today. My name is, as you mentioned, Annette Iyer, and I'm the National Assistant Vice President of Patient Engagement with the American Lung Association. And, you know, the Lung Association was founded over 115 years ago to eradicate tuberculosis. We are using the same founding principles to ensure that our nation can address today's pandemic and prepared for future lung infections like COVID-19. You know, really improving lung health and preventing lung disease is core to our mission. Americans have trusted us to protect their lungs for over 115 years, whether it's researching treatments and cures for lung disease or advocating for laws that protect the airs that we breathe. Our work is really focused on 4 strategic imperatives, 2 of which are to defeat lung cancer and improve the quality of life for those living with lung disease. As we know, lung cancer has been in the shadows for far too long, and our goal is really to be part of that national conversation and educate the nation about the fact that anyone can get lung cancer. We launched in 2014 Lung Force, which is our nationwide initiative that unites men and women and their loved ones from across the country to stand together against lung cancer and for lung health. we are continuing to work to change people's minds about what does it mean when you have a lung cancer diagnosis, so that everyone understands the risk. You know, again, we raise our voices for innovations, for research that'll help lead to early detection and more personalized treatments so that everyone has a fighting chance. You know, we have committed over $10 million specifically for lung cancer research, with a focus on projects that are designed to find cures and prevent and release suffering associated with lung cancer. And, you know, I talked a little bit briefly about, you know, our comprehensive approach to defeating lung cancer. And it really, we focus on efforts in prevention, early detection, awareness, research, and advocacy. And support, that all will move us closer to making sure that fewer people are diagnosed, and those who are diagnosed with lung cancer live longer. So that's just kind of a little bit about the Lung Association. And again, we are so excited to be a part of this conversation today.
No, thank you so much. And again, we'll kind of get into a little bit more granular about, you know, the American Lung Association, what you're doing at this time. So thank you for that intro. Katie, can you tell us a little about LUNGivity?
Yeah, absolutely. Thank you for having us, Sarah. My name is Katie Brown. I am the Vice President of Support and Survivorship for LUNGivity. I've been in the lung cancer space for about 20 years when my dad was diagnosed with lung cancer, and for much of that time with LUNGivity. LUNGivity is the nation's leader in lung cancer-focused research, education, and support. So we empower patients to be active decision makers in their treatment process. And we do this through our extensive educational resources, our online peer-to-peer support, and our in-person as well as virtual support programs. We provide community of empowerment, support, and hope, as well as survivorship conferences and more than 80 awareness and fundraising events across the country.
Fantastic, thank you. And then I'm just going to tell you a little bit about Inspire. So when we put together these town halls and we started to invite advocacy organizations, there's all different types of organizations, as you can imagine, because there's really all different types of issues surrounding various cancers, and then all different types of patients, as well as caregivers that need good, reliable, credible access to information. So one of our first outreaches was to Inspire. I'm just going to read a little bit about who they are. They're the leading health community with more than 2 million patients and caregivers uniting to safely share health experiences and find genuine support. They're the American Lung Association's lung cancer community, and they have 111,000 members worldwide. Inspire helps the life science industry integrate patient centricity into the pharmaceutical product lifecycle, from clinical trial design and recruitment to post-marketing branding and unbranded activities. So Inspire really has this phenomenal footprint where they were able to reach out to, as you can imagine, many patients, caregivers, people involved in this space, which has really led to it being such a successful launch of a virtual town hall on lung cancer. So I did want to give them a shout out because they have connected us with exactly the audience we wanted to have, and I think that's going to make it all the more impactful. So I say thank you to them. Okay, so Annette, you know, you talked about the American Lung Association being 115 years old. When I think of the American Lung Association, I kind of think of things that we've come to know from kids. You know, from when we're small, we know the commercials that are, you know, don't smoke, don't start smoking, give up smoking if you're already smoking. And, you know, it's very much like the American Cancer Society. It's just a staple in advocacy. Mm-hmm. And I'm so grateful that you and the organization found value in being able to have participated in a town hall like this, because what we really want to do is let people who are home, probably for the first time in any of our lives, people who are home know that they're not alone while they're home, that they still have access to a great deal of other people that are committed to the things that, you know, worry them, give them anxiety, give them encouragement, make them feel connected. So I want you to talk a little bit about what you as an organization have been working on to make yourself much more accessible, much more visible. Even though you're such a long-standing organization, how are you reaching patients now that we're in this time of COVID-19?
Great, thank you, Sarah. You know, and even prior to the pandemic, you know, we recognize that many lung cancer patients may not be willing or able to seek support in an in-person format, which is why we've invested quite a bit of energies and resources into virtual support communities for lung cancer patients. And as you mentioned, you know, we're so proud of our lung cancer survivor community through Inspire. You know, it does have 111,000 members worldwide. And, you know, even from February to April of this year, we had 5,000 people join that community. So it is very visible and a very real dialogue for people. And it's addressing a big need. You know, we find that it is just really important to support these communities, because being able to speak freely with a trusted and supporting group can positively impact one's health and especially one's mental health. You know, but not only talk about the memberships, you know, in the past 12 months from Inspire on, you know, in our, we have 9 communities, but this is our largest one, the lung cancer one. There were 30,000 posts from peer-to-peers just on that community in 12 months alone. And, you know, we did a little bit of a research with John, and, you know, in March, starting in March, there were over 600 posts about COVID-19 just in the lung cancer community alone. And, you know, COVID-19 had a word count of over 1 million. So people are talking about it, they're going to it. It is such a critical resource for individuals. And so I highly encourage, if you haven't joined Inspire yet, please go to inspire.com and select the community that you want to be involved with. One of the other things that I'm very excited about is in December, we started our partnership with Immerman's Angels. If those of you are not familiar with Immerman's Angels, they have one mission, and that mission is to match cancer patients with other patients like themselves or caregivers. We're proud that we are their lung cancer partner, and so that has really been a great resource for our organization to collaborate with them, because it's more than the online. It's making phone calls and coming in contact with someone that you're going through together, like having a similar diagnosis. Another resource that we have that has been a staple for us is our lung helpline. It's 1-800-LUNG-USA, but it's staffed by nurses, respiratory therapists, and cessation counselors who can help answer any medical questions that patients and caregivers may have. You know, in addition to all of those online resources, you know, we've really been leading the charge on COVID-19 communications. We have that on our website that lists everything from updated webinars, our chief medical officer, Q&As, blog posts, and it has a really big, robust listing of all of the resources from the Lung Association and from the CDC. So it is a great way to connect with folks too, because right now, social isolation is a real concern and fear for individuals. And so our online communities have been a great resource for them.
Yeah, no, that's amazing. And, you know, even the statistics of showing how many people are seeking, you know, information, connection, just, you know, being able to go somewhere that you know that if you type something in, if you ask a question, if you review a message board, that other people are, you know, experiencing the same things. I think that lends so much to our mental health at this time that, you know, we really aren't experiencing anything in isolation, right. That there are many others that are feeling the same way.
And many of our Lung Force heroes, they are taking on the role as an Inspire ambassador, which is someone that can help, you know, create those conversations that, you know, you're feeling a certain way and it may not be on there yet. So a lot of our advocates have become involved with being ambassadors to help create that conversation and dialogue for folks.
Yeah. Katie, I want to ask you kind of a practical question. You know, there are advocacy organizations, obviously like American Lung, that have hundreds and hundreds of years of, you know, foundation. There are organizations all over too that are anything from grassroots, you know, for a very specific tumor type to maybe a very specific race or gender, where there really are communities of people. You know, LUNGivity seems to be smack in the middle of that, where you're saying like, we want you to find us so that we can become a resource for you where you are. And at the same time, we want you to know that we're working on these overarching things like research, like access to treatments, et cetera, that matter to the population of patients living with lung cancer. You know, have you found that since late February, early March, that LUNGivity has had to revisit the way you access or the way you invite people to access your resources? Talk to us a little bit about some of the things you've changed in order to meet that need.
Right. So LUNGivity recognized early on when we were supporting patients that you really have to reach patients where they are. You know, there are some demographics of patients who are very comfortable with technology and being online. And then there are a huge population of patients who are not online at all and would rather be in person or over the telephone. So LUNGivity has a lung cancer support community, which was created in 2002. And there are over 400,000 lung cancer specific posts on our message board. It's all lung cancer forums for people to access who are very comfortable on a message board. We have over 18 private patient communities on Facebook for folks who are on that social platform, and that's broken down by gene mutation and different demographics in that way. And then we had our in-person, you know, lunch and learns and conferences and events that way. So when COVID-19 happened, we really had to do a sharp pivot in terms of all of our in-person events that we were having. Our Lifeline program, which is our peer-to-peer program, which very happy to say, Annette, that we provide a lot of the mentors for Immerman Angels. We're all part of the Volunteer Management and Cancer Care Cooperative. So we really work together to help support that uptick of support that a lot of patients were calling in for the last few months. We also pivoted a lot of our lunch and learns in partnership with healthcare facilities across the country to put on virtual events like these. And then of course, you know, we created a web page, a comprehensive web page on our website that was specifically for COVID-19 and lung cancer. So we instead of doing in-person events where, you know, patients were interacting with experts in that way, we are providing up to the minute and up to date COVID-19 information, how it affects people with lung cancer, Q&As with experts in the lung cancer field and other lung cancer focused nonprofits, weekly interviews, videos, those types of things to bring a virtual community to people who maybe in the past were just getting their information by coming to one of our events. It's a very different and uncertain time for a lot of us right now. And we've just been able to make that shift into a virtual environment. We also recognize that there is a huge financial burden, even before COVID-19 for people impacted by lung cancer. But we launched a Breathe Easier Emergency Response Fund, which is for lung cancer patients who are specifically impacted by COVID-19. And so our helpline operators are answering calls from patients who are interested in filling out for that fund. And so we're just kind of racing by the seat of our pants to be able to really support patients and to let them know that while we have to be apart, we don't have to be alone.
Yes, I love that. While we have to be apart, we don't have to be alone. That's definitely a takeaway that I think all of us not only want to hear, but we want to feel it. So thank you for that. Annette, you know, as VP of Patient Engagement, I know we talk about engagement. You know, we as a medical education company, our engagement predominantly was with oncologists in February. And then in March, you know, to Katie's point, it's like the world turns upside down and you've got to fly by the seat of your pants and figure out how do you continue to reach people with meaningful information. You know, we think of engagement in this very one-dimensional, it's like, here we are, there you are, let's connect. And I feel like with the emergence of COVID-19, that one-dimensional feeling of engagement really has become so much more emotional. Because, you know, now you're saying, here we are and we have what we know we have, and there you are, and we know that you're feeling isolated. And engagement means so much more. It's not just, you know, come and scroll through information. It's like, come for connection. So how does the American Lung Association, through partners like Inspire and other programs, maybe even that goes outside of cancer alone, how do you respond when you have to pivot so quickly as a large organization to kind of incorporate some of that emotion?
You know, you're absolutely right. And this is such an emotional time for people. And, you know, part of the simple thing that I know many organizations are doing right now is, you know, that one-on-one outreach, picking up the phone and calling people that you know and letting them know what resources are available to them. As you said, not everybody is available. They don't have access to online resources, but a phone call, you know, the helpline and those types of things, trying to find out what they need and how we can adjust to those, you know, changing needs. You know, one of the things that I love to take a moment just to talk about that we had to pivot very quickly as, you know, our Lung Force Advocacy Day. Every year we take 50 lung cancer patients from every state, including the District of Columbia, to Washington, D.C. to meet with their members of Congress. This year was a big year for us. It was our 5th anniversary of Lung Force Advocacy Day. And we were also celebrating the 10th anniversary of the Affordable Care Act. You know, we had to make a decision very quickly because of COVID-19. You know, what do we do? You know, do we cancel the event? Having the health and safety of our patients first and foremost, and our staff, you know, do we cancel the event? Do we do a digital campaign or just do something on social? You know, do we just send emails or place random phone calls? Or, you know, do we create a remote event, not virtual, but an actual remote event that makes them still feel a part of it? You know, and I'm so proud of our CEO, Harold Wimmer, and our leadership, because they made the decision very quickly to keep the momentum and the spirit moving forward. And we quickly transitioned that into remote. And that way we provided the opportunities for patients across the nation to speak to their members of Congress about the urgency of funding for biomedical research and ensuring everyone has healthcare protections. COVID-19 is top of mind for everyone, but so are these issues. They are just as critical, and legislators want to hear from them. You know, through that effort, we placed 172 scheduled meetings virtually, well, over the phone, with 98 Senate offices and 84 House offices in March. You know, and it really was, our heroes were very excited because they had the opportunity to do a FaceTime, to do a Skype call with their legislators, and the legislators were very responsive and to our asks and in the communications. You know, one of the biggest things that I want to mention about is we launched a COVID-19 action initiative, which is a $25 million initiative to end COVID-19 and defend against future respiratory virus pandemics. You know, that action initiative will be used to expand the Lung Association's ongoing respiratory research program, enhance key public measures through education and advocacy. This initiative will also work with public and private entities to increase research collaboration, to develop effective vaccines, faster detection tests, and treatment therapies in order to stop future respiratory virus pandemics. You know, if you haven't heard about it, I encourage everyone to go, and we can send this as a follow-up, you know, go to lung.org/CV19 to learn more about this exciting initiative that we're taking nationwide to help defeat this pandemic and future ones.
Fantastic, fantastic. And, you know, Katie, as Annette was talking, I was thinking, there really are so many different facets to all the things that we all do. And when we're put in situations like this, we almost have to figure out how we align and how we really stay true to our, you know, overall mission of outreach, but also how we evolve. And, you know, even thinking about Annette talking about COVID-19 being a respiratory virus, you know, having the American Lung Association on today, I was thinking of it as lung cancer. That's what we're going to be talking about. But when you hear or, you know, contextualize, the American Lung Association does have so much investment in COVID-19, it surely makes you realize that even support organizations like yours, Katie, and like mine that support patients with cancer, we can tap into resources of larger groups that not only, touch what we do, but have applications to other things. So when you think about longevity and you think about the way your membership or the people who are, tapping into, find communication about what you do and how you can help, do you find that there are opportunities to give them more education on the complexity of COVID-19 in the lung space?
Yeah, I would have to agree. I mean, we definitely partner with thought leaders across the country. We put together patient advisory boards with the FDA and the CDC and with other experts to answer questions that our patients, their caregivers, maybe other healthcare providers have specific to COVID-19 and lung cancer. So we definitely really try to stay in that lung cancer space. A lot of the things that we address are psychosocial in nature as well. So you have people who maybe they're secondary procedures or going in for treatment or traveling to a clinical trial is very worrisome for them right now because they're not quite sure, what their risk is and whether or not they can delay their procedure a month or 2 or 3. Lots of self-care issues as well that we're dealing with. But we have to reiterate the importance of collaborating with folks across the cancer community, other organizations, large organizations, healthcare providers, local organizations. We can't provide the complex support and information that people need alone. And we are very happy that we're doing it in collaboration with other leaders across the country.
Yeah, and you mentioned, self-care. It's so important to look at this as both we're experiencing this as individuals, but we're experiencing this as a collective also. And, even before we were going live today, I was talking about just how emotional the first few weeks, even the first 2 months of this was on me individually. And I know that I'm not alone in that. Do you find that, Annette, I'll start with you and then I'll ask Katie the same question. Do you find that the people who are accessing information or sharing on your social media platforms or working one-on-one with some of your ambassadors, is there a greater emphasis on mental health than before?
Absolutely. And we do and I want to, with Katie, we have to all do this as a nation or like organizations. We do this together. I mean, we're in this together. The collaboration is so critical. And I think that, part of the research that we continue to do is with our patients as well. We have, several patients that are on the Department of Defense lung cancer research team. We have them, we have our own lung cancer patient advisory group so that we can really access right now. And what we're hearing from them is absolutely, they're scared. Like they're not sure who to believe because what the federal government is saying versus the state government. And, we want to be, as all of our organizations, we want to be that trusted support. And we talk about it from the science perspective. And here's the actual information that you have. And we want to make sure that we're all consistent in our messaging because they are confused to, what happening now and what's happening in the future.
Mm-hmm. Absolutely. I think, Katie, everything that Annette just said, I feel being a consumer of that information, all of us can agree there's been such a lack of consistency from various and even sometimes shared resources. You look to the federal government and you could have 3 different people on the same podium saying 3 different things. And your takeaway is, what am I supposed to do? Just give me, should I be worried? Should I not be worried? Should I be planning on letting my family kind of get back, resume to normal activities? Are you finding too that mental health and that confusion around, overall messaging is first and primary in conversations that your team is having with your membership?
Yeah, absolutely. So not only did we have to sort of pivot the way that we work for the health and safety of our staff who don't have lung cancer, we had to relearn a way to educate and support patients who are in the thick of their treatment, who, because of this rapidly changing environment and all of the information that just happens to be all over the internet and all of the news that we consume. So we had to figure out a way to really focus on ways to help those patients. As somebody who is a cancer survivor and immunocompromised myself, I could really empathize with a lot of the things that they were saying. Our helpline has received a huge uptick in calls, and we have oncology social workers who are answering those calls. And we just have to reiterate, facts over fear, and to constantly engage with our patients and provide them updates, weekly alerts, access to experts so that they could ask questions. Information really is power, and just for me personally, being informed and having that information or a way to get that information really helps alleviate a lot of those fears.
Yeah, you said facts over fear. Girl, we could spend another 2 hours talking about facts over fear, because so much of this is fear. It's fear because it's an unknown. We've never experienced this before. We've seen it play out in different areas so differently. The China experience, the Italy experience, the New York Northeast experience versus, if you live in the mountain states or even where I am in South Florida, it's so different. And so again, you can turn on your news. My mom's 73 years old. She wakes up in the morning and turns the news on, and it's on the background all day long until she goes to sleep. And I say to her, turn that off, because we live in a place that's very different from, watching Governor Cuomo talking about the issues happening in New York. And it is facts over fear, because what happens is patients that are in these other areas are reacting from places of fear, from situations that may not be mirrored where they're coming from. So thinking about, how advocacy has such an important role to play in filtering through what's, in the sound waves and giving very relevant information. And I think that that's why I'm really, you made my head spin a little bit. I'm really intrigued to think the American Lung Association both represents this as a respiratory disease and then also represents patients with lung disease, with lung cancers. Mm-hmm. So I love that, you're this kind of multifaceted resource, and I'd like you to maybe, as we round out this session, I'd like you to maybe talk to a patient looking for information, both for how they manage as a patient living with or living in survivorship or caregiving for a patient with lung cancer, and someone who's looking for credible information on the COVID-19 disease as it affects our respiratory system.
Okay, great. Thank you. One thing that I want to mention, and I think this is a really good resource that we continue to make sure is, first and foremost, is, we really need to put our voices to that federal perspective and that federal outreach, because, some of we were very excited that we had the HEROES bill that passed yesterday, so our voices were heard. But in that bill, and it helps people understand, that we want to make sure that people that have lung cancer or lung disease, that if they've lost their job or if they've lost their livelihood because of COVID-19, we want to make sure that they have improving the affordability of COBRA insurance for them, because that's critical no matter what disease you have, if you lose your insurance, you need to have the resources and understand where to go and get that information. You know, another advocacy component that we're working on is making sure that states are reopening healthcare.gov so that individuals who are uninsured can be eligible now to sign up for insurance to get the treatment that they need for their lung cancer or their COVID-19. You know, we want to increase funding for states with Medicaid programs to provide coverage to low-income Americans during this COVID-19 public health emergency. And, you know, when you talk about, you know, people were scared because of the cost and what is this going to cost me? And we want to make sure that people are required that their coverage of COVID-19 treatment, there's no cost to patients, and that regardless of if they have health insurance or the type of insurance they have. You know, and permanently protecting people, especially right now, the last thing they need are surprise medical bills. So we want to make sure that we use our collective voices and we partner with, you know, organizations large and small, because this is such a critical component to your care, you know, making sure that you have access to your care and the treatments that are available during this time. Because many people, as you stated, you know, they don't have online resources. And so we have had to, they're utilizing the helplines, they're utilizing what's in the media, you know, they're utilizing what's in the newspapers, that if you're still getting those delivered. So we really need to be all encompassing in our approach, but making sure on a nationwide level that everyone has access to treatment for their lung cancer, their lung disease, and during this COVID-19, because it's critical component that we need to be top of mind for all of us.
Yes, yes, thank you, Annette. And Katie, I'm gonna ask you the last question in this session, but I do want you both to stick around because we are getting so many questions for and comments for both organizations. You know, Katie, as VP of Survivorship, we've talked a lot about, you know, patients with active disease, resources for patients who are kind of wondering about what they should be expecting. When you are a patient in survivorship, you always, at least in my experience working with patients with previous cancers, it's always on your mind, is my cancer going to come back? And, you know, there's been such a push to eliminate what they call non-essential visits. And for so many people who already have the layer of anxiety of what COVID-19 just on its own is, there's this added layer of anxiety that, you know, if I had an upcoming screening scan or, you know, follow-up scan, I'm 3 years out, it was canceled, it was delayed, you know, I was told that I'd be called when things were kind of ready to open back up. What do you say to patients right now? What would be your advice in terms of seeing how some of these schedules have changed?
Right, so this answer could be very different depending on where you're getting treated in the US. And we've seen the difference between like a large university or teaching hospital or an NCI designated center as opposed to small community hospitals. I would just say that, you know, in the lung cancer space, that there are a lot of people that may never be out of treatment. So they are living with lung cancer, and they may be living with lung cancer for the rest of their life, whether that's, you know, 10 days or thousands of days. So they need help navigating their daily life on a normal basis, a daily life with lung cancer, all of their side effect management and follow-up treatments and clinical trials or recurrence issues. So all of that is something that we're helping patients navigate anyway. Throw on top of that COVID-19, and that's even more added stress and worry and fear for a patient. So we just really, we encourage our patients to take advantage of telehealth, to continue the dialogue with their nurse navigators, their social workers, calling into our helpline to talk to our oncology social workers and the patient navigators that we have on staff. They usually have worked out a plan, at least now, you know, several weeks out, of how they're going to protect patients who are coming into their facilities. And so I feel like having that conversation really will alleviate some of that anxiety that you have when you're just wondering, or when someone says, let's put it off, or let's wait and see.
Yeah.
I would just encourage patients to ask those questions, or find an advocate who can ask those questions for them, and then have that dialogue with their healthcare provider and take advantage of the telehealth that's happening right now. You know, a lot of times just talking to your healthcare provider puts you at ease.
Yeah. No, thank you, Katie. I think that that's very meaningful for people who have that question kind of front of mind. Well, ladies, thank you so much for spending this time with me as the opening session. As I said, don't go anywhere, because as we round out, we'll all get back on for a Q&A. I thank you to both of you for everything that you're doing and everything that your organizations represent for the cancer community. So I will be checking back in with you in just a little bit. I'm going to ask my team to transition us to the medical leadership portion, and we've got a good deal of questions for the doctors. Okay, great. Well, I think we're almost ready. I'm just waiting on Dr. Dietrich. Wonderful. Well, welcome to all of you. Thank you for giving us your Saturday afternoon. I will tell you, this is our probably fourth or fifth virtual town hall on various cancers, and it has been received by thousands and thousands of patients in such a meaningful way. So I do have to say that, you know, your impact goes from clinic into the social media sphere and touches so many people in a place where they really feel vulnerable and they're looking for credible answers. So I thank all of you for being here this afternoon. I'm gonna, I introduced you in the beginning, but I'm gonna ask you each to introduce yourself and where you're coming from, and then, you know, talk to me a little bit about the patients that you see in your typical daily practice. Dr. Dietrich, I'm going to start with you.
Yeah, hello, Sarah. Thank you so much for having us today. I'm Martin Dietrich. I'm a medical oncologist with Florida Cancer Specialists and Research Institute here in Orlando, Florida. We obviously had a great deal of concern with COVID-19. In my daily practice, I focus on patients with solid tumor malignancies. We see a lot of times getting patients that are on chemotherapeutic and immunosuppressive agents. We've had obviously a big shift. A lot of patients moved from being seen inpatient to outpatient by televisits. The hospital, the capacity has gone down. So we had a dramatic adjustment in a very short period of time for our clinic population in the last couple of weeks and months.
Wonderful, thank you, thank you. And Dr. Dietrich, I'm going to probably circle back around to you and maybe ask some questions that are a little bit more geographic specific, like the age of our patients here in Florida. Dr. Kazmi, please introduce yourself and let us know a little bit about where you're coming from and what your patient clinic looks like on a daily.
Thank you, Sarah, for having us all today. So I am a thoracic oncologist primarily. I do have a fair number of breast patients that I see. I practice at the Cancer Treatment Centers of America in Philadelphia. I happen to live in New Jersey, so I have sort of perspective across a couple of states with my colleagues and friends and family. So our hospital is unique in that it does not have a regular hospital attached, does not have an emergency room, and thus we don't see active COVID patients. We are primarily only a cancer center. We do have inpatient as well as outpatient services, specialist services, surgical, radiation oncology, and radiology services. So we've had a little bit of a different impact than, say, our neighboring cancer centers that are attached to larger hospitals that have had to have areas closed off for COVID patients, and really just patients who might be more afraid to go into a regular hospital that has emergency rooms. So we've been a little bit more insulated, I would say, than those areas, despite being in Philadelphia. Having said that, our patient population is unique in the sense that we don't all have local patients. A lot of our patients travel quite a bit to come to us. So we have a little bit more perspective across different states. Also limiting traveling, flying. A lot of our patients used to fly. Some of our patients also used to take Angel Flight and those volunteer services that have actually more stringent criteria than the FAA and have shut down all activity, appropriately so, during the COVID-19 crisis. So a lot of different moving targets. There's 5 CTCs across the country, and of course we're all affected differently because, as you mentioned, geographical differences and local issues.
Yes, yes, thank you, Dr. Kazmi. I'll be back with you on very specific questions about the Northeast. And then Dr. Salgia, thank you for being with us from another time zone. If you would introduce yourself, where you're from, and what your daily practice looks like.
Sarah, hi, good day everyone, and it's definitely a different time zone here in California. And thanks for organizing this, and thank you for everyone for attending as well. So I'm a medical oncologist. I'm the chair of medical oncology here at the City of Hope, and I oversee the 31 sites for medical oncology that is owned by City of Hope, and we have a large hospital that's in Duarte, California. And at the same time, we have a large number of practices throughout Southern California as well. We do see a number of patients. Of course, we're very cancer focused, and I'm a thoracic oncologist, so I only see lung cancer patients, and of course, chest malignancy patients as well. And of course, we have a good test that is available to us as well. We have a partner called TGen over in Arizona, and they are developing the antibody test that is going to be available soon, I hope, but they also have the PCR test that's already available. It's FDA and CLIA certified. So we do have a program in place for COVID-19 patients, and we do follow the mitigation plan that we have.
Mm-hmm. So, I mean, we're coming from Florida, from Pennsylvania, and from California, all very, very, very differently affected by COVID-19. Dr. Dietrich, you know, Floridians are, especially where you are in Orlando, you know, there's such a diverse population of both people who live and work there, and then people who come to, you know, kind of play and explore there. And Disney is such a staple in Orlando. And I know that, you know, this virus has had such layers of impact on various geographies. You know, as you saw it unfold over the last couple of months, how can you describe, you know, both clinical practice and then just the environment with which you, or, you know, within which you practice, and how can you describe what that's been like?
Well, obviously we had a dramatic change in Florida. We were typically not prepared, in all honesty. I think a lot of what happened in Florida was the typical spring break development. Many of them have seen them on TV. And there was a sense it hasn't really hit here. This is a problem in Italy. That's a problem in China. But I think when people realized, and the first epidemiological data from China came, that older populations are affected, obviously it hit Florida like a wall of brick, that we may be actually the most vulnerable geography in the United States. And we kind of slammed the brakes on a lot of things very quickly. And as you know, when you slam the brakes, a lot of things keep flying through your car, and you have to rearrange things very quickly. We had no testing capabilities at the beginning of March. We have not had a screening protocol. We didn't have proper personal protective equipment for healthcare workers. So there was a lot of fear and uncertainty. We went off of limited data. We didn't know what to do. So there was a state of panic that then eventually resulted in the shutdown of basically the city and the state at the same time, after kind of taking it a little bit on the light side in the beginning. We've tried to establish protocols, but we really are faced with a challenge, because we obviously had a great deal of fear and uncertainty about COVID-19. But on the other hand, our cancer patients were not waiting for a diagnosis to present itself, there was still a lot of need for treatment. So we kind of had to balance what we didn't know about COVID versus what we knew about lung cancer treatment. And we kind of tried to balance this. Lung cancer in particular is not a cancer that can wait. I think many of our patients present with symptoms. Many of our patients present with the immediate need for treatment. And one of the concerns that we had is that we are actually harming patients, even though COVID-19 may not have arrived here. Fortunately, so far, Central Florida has been spared from the worst. We certainly have had a milder course so far than what we've seen in Italy or in the Northeast. The colleagues there have a dramatic challenge in providing proper medical care, and they're certainly doing heroic efforts in the way they're splitting the concern about COVID and cancer. One thing that I have to recognize, and even though our patient visits have been less than typical, because of the enormous amount, and I think that's something that we have to acknowledge, that COVID-19 is not only an infectious concern, a virology concern, but really a mental health crisis at the same time, where patients, out of fear and out of concern about what they've heard, really try to avoid medical facilities. I mean, when you ask our emergency room doctors, we don't see heart attacks. We haven't seen heart attacks in a couple of weeks, and they certainly still happen. They may just be happening at home. So we've had a dramatic adjustment over the last couple of weeks. We try to focus on non-immunosuppressive therapies. I think the data is emerging that patients that have been on immunosuppressive therapies may fare worse with COVID-19. So we switched surgical procedures in early stage to radiation treatment. We spread out treatment intervals. We actually coincided with one of the FDA approvals for a longer term interval between immunotherapy treatments from 3 to every 6 weeks. Try to avoid clinic contacts with telemedicine. This has always been a wish of ours, to be able to communicate by camera, and what wasn't possible for the last decade all of a sudden happened within a few weeks. So there were certainly a lot of challenges, but I'm also hopeful that we'll actually learn a great deal about protecting our cancer patients, not only in the context of COVID, but also in the greater context, and that there will be some infrastructural improvements that may actually benefit our cancer patients in terms of access, in terms of protecting them in the very near future.
Yeah, thank you for that, Dr. Dietrich. Dr. Kazmi, as Dr. Dietrich was talking, I was thinking, we all know in this community, in the cancer treatment community, we all are very pathway or protocol driven. So it's, you start with this, you monitor for this, you react this way, you escalate because of that, you de-escalate because of that. And while there are nuances with, the way you treat, maybe more conservatively or aggressively based on the presentation of the patient, cancer's or the treatment of cancer's kind of been turned on its head, because in the same way that we've had to innovate in terms of clinic visits, telemedicine, the way we do research, et cetera, we've also had to innovate in the way we think about treatments. And I want you to just talk to us a little bit about how that has evolved in the medical community, when so much of what we do is data driven, and we've been hesitant to make changes outside of data. Now we're thrust into making these changes. Talk to us a little bit about that.
So yeah, Sarah, as Dr. Dietrich said, we kind of literally came to a full stop with a pandemic that we still know very little about, a very dangerous pandemic that's literally stopped the whole world. We are used to having information, data, and it's normally, when we speak to our patients, we talk about risk-benefit analysis of treatment, no treatment, stage, risk of treatment, risk of not getting treatment. And we are fairly comfortable with the statistics on both ends to make a valid point and a valid argument for most patients in terms of what they should be doing. Sometimes it's 50-50 and you're not really sure, and the patient gets to really make a decision. The hardest part, I think, right now is we really have two pandemics. We have a pandemic of an actual disease, coronavirus, but we also have a pandemic of misinformation.
Yes.
And I think there's been an explosion of this underlying misinformation that has been sort of I think going on for a while about various topics in a very polarized country, right? Geographically, we're polarized, politically, we're polarized. And so I think that the level of misinformation has skyrocketed. And when there's a void of facts, true facts that we can really stand by and say, no, that alternative treatment's bogus, I can tell you that that's BS, and I have a phase 3 trial of actual treatment. I can't definitively even say if someone's COVID test is positive 6 weeks after they had symptoms, are they still infectious? Gosh, I don't know. If they have antibodies, I would typically say they're immune, but gosh, I don't know. I don't know so much about this disease that it really makes the misinformation flourish even more. So I think the biggest challenge has been through the medical community as well as the lay community and the patient community about what do you believe, who to believe, and who to look to. Federal, state, is it CDC or is it the WHO? Is it sort of the international community? And does all of that apply to you in that geography? So I think that's been the most challenging, I would say, from my end. Data, in terms of data emergence, what's interesting to me about lung cancer is that the immune flare that's associated with the severity of COVID-19 disease, there's been theoretical, concerns about current checkpoint inhibition and the increase in immunity and the immune response. Should we be holding immunotherapies? Is immune suppression actually good or better? It kind of, there's so many opposing theories and ideas and thoughts, and I'm so anxiously awaiting for some data that's concrete. We do have some Chinese data about patients with lung cancer who certainly fared worse, which makes sense. A lot of the COVID-19 disease is pulmonary, most of it anyway. And these patients already have pulmonary issues, if not from smoking, from the cancer and so forth. But is it the treatment that's causing them to be worse or better? We don't really know. And as Dr. Dietrich pointed out, this isn't elective. However, for early stage patients, we are so set on, okay, you've had resected stage 1, 2, maybe 3A disease. We're following you every 3 to 4 months for a couple of years. Well, gosh, if that's 4 to 5 months, 6 months, is there really a necessity for a 3-month CAT scan on that patient who doesn't have active disease? So for those patients, I've delayed, scans, routine imaging if they're not symptomatic, but obviously if they're on therapies, of course, they run the risk of increasing morbidity, mortality if their treatment is delayed. So that is a very serious conversation.
Yeah, and you mentioned we're doing a lot of these things in the absence of data, which is so foreign, again, in the cancer community, but you have to just find real-time solutions, because as Dr. Dietrich said, no, this is still an urgent situation that we have to make decisions on. Dr. Salgia, I'm going to ask kind of a very specific question, as we've been having a lot of patients asking. So for newly diagnosed metastatic patients, the idea that over these last years, we've been so focused on typing these cancers. So getting, these next generation sequencing tests or comprehensive genomic profiling tests to, to give more information about a patient's cancer. At this time when you are doing more telemedical visits, can you talk to me about the continued importance of having that information up front before you start talking about treatment decisions, and how you're coming about getting those patients in, after their surgeries, getting those samples sent out so that you do get the information to be able to treat?
Great question, Sarah. And that's on the minds of many of our patients and our physician colleagues and healthcare providers. It's crucial to get all the information that you can. And what's important is to be able to go to an institution where they have the availability to be able to do molecular diagnostics. And, lung cancer is no longer lung cancer. It's a very heterogeneous disease. You can have EGFR mutations or ALK translocations or RS1 translocation, BRAF mutation, RET translocation, for which the drug just got approved last week. As well, you can have heterogeneity in terms of adenocarcinoma versus squamous cell, versus small cell lung cancer. All of those are very crucial to identify. So it is important to go to a facility where you can do all of this molecular genotyping. And you can also look at, let's say, the PD-L1 expression, so proteomics evaluation in that sense. You also have to be able to have great pathology colleagues who can actually read the slides. So I would not delay in any way, but I would say one needs to be able to get the biopsies done appropriately. And there's also a role for liquid biopsies. So if patients have availability and if payers are willing to pay, and if there are various research protocols that are available to look at liquid biopsies, what are called cell-free DNA, and look at diagnosis of EGFR mutation or ALK translocation as an example, and do it a little bit faster and have a good turnaround time, that's an important pathway too. But we should also be cautious, right? Tumor tissues are incredibly important. Biopsies are incredibly important. The liquid biopsies, you can have secretors versus non-secretors. So you may not be able to catch that tumor heterogeneity or the molecular abnormality that's important. So for patients and for healthcare providers, we're actually recommending, please do not stop to diagnose properly. And then ultimately the molecular diagnostics are important as well. And then the therapies are important.
Yes, thank you, Dr. Salgia. I know that that has been on the minds, just with, surveillance and things like that has been on the mind of many patients. Dr. Dietrich, do you have a takeaway message for different types of patients? So, ones that are high risk, maybe without a cancer, ones that are newly diagnosed, maybe in the early stage setting, ones that are metastatic, having been going through therapy, and then those that are in survivorship. Could you just maybe give us a takeaway message for each one of those groups concerning COVID-19?
Well, I want to start with saying that COVID-19, it creates uncertainty and a lot of anxiety among providers, medical staff, and patients and families alike. I think that's an acknowledgement that we can share. It is not helped by the different channels of messaging that are reaching us, that are really oftentimes portray opinions more so than facts. And I think it is important to sometimes ask that question: what is fact and what is fiction? I think I want to be positive about the opportunities that we have. One thing is that it really appears that our efforts have succeeded in many parts of the country to flatten the curve, to make hospital capabilities and capacities last. I think we have to be flexible in terms of how we approach individual patients and have that open discussion, saying we don't know. But if I have a patient that's 3 years out from treatment that had a lobectomy in 2017, I believe it is a very reasonable scenario to prioritize their COVID risk higher. I think there's not a sign for any sort of de-escalation. I would consider any lung cancer or cancer patient in general as elevated risk. I'm not sure high risk is the right term. And I would think that we really have to avoid COVID fatigue, meaning the utilization of masks, the utilization of hand sanitizer, sensible measures. We've been kind of scared with messages that aerosols are lingering for 8 hours or 10 hours in the air and days on surfaces. I think infectious transmission for the most part is occurring from human to human. And I think that's important to stay motivated and disciplined in terms of resection. I think there's going to be a big push driven economically to reopen the country, driven by mental health concerns to reopen the country. But I think if you're a cancer patient, I think you have to be extra cautious. If you have children in your own home, it may not be as dangerous for a young child to go back to school and contract COVID. Obviously, bringing COVID home is a major concern. And I think this is where you have to advocate for yourself and really tailor this to the individual assessment, possibly with the help of your physician providing letters and other things. It's a very, very difficult situation to be separated from family and children and celebrate birthdays and holidays and things apart. Obviously, the risk exponentially higher once schools and kindergartens are opening up again. So my feeling is we've so far have much to learn. And I think as long as we don't really have what in my opinion is the best way out of this, which is a vaccine, I would advise staying disciplined, staying a little bit paranoid even from making sure that you don't get infected without bringing anxiety into this. And the other one is, and this is another positive thing in all the bad messaging, I have never seen, and I wish we had this in the cancer community and we could preserve this, an unprecedented effort in terms of vaccines for a virus that we've never tried to build a vaccine for, at least not in humans. And my hopes are that because this is a global, unified effort with billions and billions of dollars invested and a great deal of priority given, that we will have a vaccine in the near future, and that there will be a time after COVID where we can go back to practicing cancer care and cancer research with the same level of evidence base that we could prior to COVID-19. I think the time is coming. Time is not there yet. So a lot of the opening phases that we're seeing across the country do not apply to cancer clinics and cancer patients, cancer treatment providers either. But my message is, I think it will be there. I can't give you an exact date. I wish I could, but I think it's going to be there the soonest it is humanly possible, because of the tremendous efforts that have been made. And my last message is, you'll hear a lot of negative things and a lot of negative concerns. I think it's important for your mental health and the strength that you need to fight cancer, to tune some of these out. Do the sensible things. Do what we know helps with risk reduction and other things, which I advise for my cancer patients in regular respiratory seasons already. Obviously now much more motivated in the setting of COVID-19, and really try to preserve your mental health and sanity by practicing some hygiene from the input channels that you're taking in.
Yes, you know, what's so funny is as I listen to the three of you, and you specifically with your answer, Doc, I wish that was the type of information that we were getting on the the general news waves. Going back to what Dr. Kazmi was saying, we have a pandemic of misinformation. This thing's been so politicized. It has been used for profit for so many people, really at the expense of global citizens. And if we just had some of the takeaways that you just shared that are very practical, very reasonable, very emotional, and common sense, I feel like people would be responding differently. One of the things you said that I want to talk to Dr. Kazmi a little bit about, you want us to avoid having COVID fatigue. As you know, you're in Central Florida, I'm in South Florida. When our governor opened up the state, I can't tell you on social media, people with pictures of finally I got my hair done and look at these nails and like all this stuff. And I'm thinking the COVID fatigue has already set in. These people aren't thinking about wearing masks and being safe. And they're almost thinking that the trigger to open was really the trigger that this has gone away. And, that causes a lot of fear. Dr. Kazmi, as a mom, as a wife, as someone who treats patients with cancer, as a colleague, as a researcher, all the roles that you play, how do you communicate to your family in balancing fear, facts, emotions, direction? How do you balance that, going from clinic to home, going from home into your community of peers?
Yeah, wow. So that's a big question. Obviously, we all went through, I think, almost like stages of grief when it became coronavirus. Maybe it's something that's happening in China. Maybe won't affect us. Looks serious. Oh my God, it's here, and now I'm freaking out. So I think initially there was a bit of denial, of course, on my part, and I think a lot of our colleagues, and then the denial about needing PPE, and then really when the PPE started becoming a real serious thing, there was a visual awareness and a day-to-day breathing awareness of what it is that I'm dealing with. I can't breathe in a mask very comfortably. Nobody can. I can't touch my patients. I'm a very touchy-feely person. We hug, we hold hands, we just do a lot of things that are social and emotional. That's so much more of the healing than just sort of the chemotherapy and the immunotherapy that goes in. And that's a big part of what we do. So that was a change. My routine from going from home to work, I changed to scrubs, I put my hair up, there's no more jewelry, there's always a mask. I haven't worn normal clothes, and this might be the first time I'm wearing a real shirt in 2 months. Honest, it's pajamas to scrubs. And so my children who've been basically housebound for 9 weeks now, but who's counting, right? For them, it's been a different adjustment. You know, I travel a lot for lectures with my work, and so I was away a lot prior to all of this. So part of them and my husband are very happy that I'm grounded. I am not flying anymore anywhere. So that's one good thing. I'm also cooking a lot of meals at home because we're still very paranoid about ordering out. So we're doing that together. So we've made it a little bit more fun. The kids, of course, miss their friends and activities, and they have a lot of questions. So we talk openly about the fact that coronavirus is serious. You know, my 6-year-old talks about quarantine and COVID-19 all day as if it's normal for a 6-year-old to talk about that. And they've gotten real savvy with Zoom meetings and muting themselves, showing me how to change my background, which is really amazing. So they've adapted. They're better with technology, I would say, than even my generation, certainly my parents. I can't get them on the meetings. They don't know what they're doing. They're clicking on all different things. It's difficult. My husband works from home. He always has. And so for him, not a lot has changed, except that I'm around more and the kids are always home, which has been a challenge. But I think overall, we try to talk about what's good about what's happening right now. I think that really our lives before COVID-19 were at a pace that was unsustainable. In fact, we talked about it a lot. This whole idea, we all had FOMO, you know, this fear of missing out. My kids had 17 activities each, and there literally is no more FOMO. We are missing nothing. There's nothing to miss. We're all just stuck here, but so is everyone else. And so there's a level of calm. There's a level of no rushing. I'm not rushing anymore to work. I'm not rushing back because it's sort of this calm of I have nowhere to take the kids. I have nowhere to go. And yes, there's some Zoom meetings and I'm not going anywhere for them. They're on my phone or my laptop. So there's a level of calm and a peace and some introspection that comes along with it. In terms of the patients, I will add that these patients live with anxiety and fear, all of our patients, by the virtue of the fact that they have cancer. And so for them, this is not a new concept, fear of something that's going to kill them. And so this just is another discussion, you know, like we would have a neutropenic precaution discussions. They're just familiar with taking more precautions. They're familiar with wearing masks in a plane or a train. I tell them to if they're going to be neutropenic. So I think my patients are more prepared for this than maybe some of the other people who feel well.
Yes, yes. No, I think that those are great takeaways. And just from a personal level, you know, it's so easy to kind of talk to physicians about how this has changed in the clinic, and then you kind of scratch beneath the surface and you start to see how you're managing both those, you know, professional changes where you really are the front lines, and then how it's changed, you know, at home. Because again, you know, in February, you were a busy physician, you know, traveling all over the world, speaking, treating patients, going to conferences to learn, all those things. And then overnight, you know, you're the cook, you're the homeschool teacher, you're all these things. You've got to be on a 12 o'clock, you know, COVID-19 leadership committee meeting on Zoom, but your little one is saying, I don't understand how to do this worksheet, Mom. And he doesn't understand that, you know, 90 other people are on the call in front of you, and, you know, that's a new balance. But I liked how you said that's happening for all of us. So the understanding on the other side of the screen is, oh, that just happened to me this morning, don't feel bad. Because we really are in this together. So thank you for sharing about how that has affected you at home. Dr. Salgia, you know, I've had the pleasure of working with you for years. I know your family, I know your commitment to medicine, to teaching, to leadership. You know, I really want to talk to you about what in this time worries you. Things like the changes that are being made in terms of enrollment to clinical trials. The things like, graduation ceremonies for medical school students going into training, and then, residents coming into clinical practice. What worries you about this time, and what do you hope that we quickly learn to correct some of those things?
Great question, Sarah, and I really appreciate my colleagues too talking beautifully as Martin did, as well as Shamia did, and at the same time, we do worry about a lot of things, but we're a healthcare profession. This is the oaths that we took, right? And as you know, and you know my family pretty well, my wife is a counselor that works at City of Hope as well. And then my 3 kids are medicine driven. So 2 are in medical school, 1 is applying now. And they're actually all volunteering to be able to help patients at the City of Hope currently, because they've all come home from school. And so what worries us is that times are no longer the same as compared to what they used to be. And we have to really adapt to what the times tell us and how we have to be safe for everyone. Social distancing is incredibly important. Nutrition is incredibly important. Mental health is incredibly important. All of those things that we took into account and took for granted, let's say having social get-togethers, having those graduation. My oldest daughter is just graduating actually next week. And at the same time, we know that we can't really do anything about that, but we have to accept to be safe. And safety is so important for our patients, our healthcare colleagues, all of our staff throughout the world, right? And I think we'll get through it, and we'll get through it stronger and with better ability to be able to handle crisis like this. At the same time, my wife and I met at Hopkins, and we took care of AIDS patients. That was in the late 1980s, and HIV was very prominent, and we didn't know. Just like COVID-19, we don't know what's going on, but we knew that we're passionate and we're driven to make sure that we can take care of our patients and ourselves as well. I think the same philosophy applies to any disease, and to be able to really provide for our lung cancer patients. You're right about the clinical trials. That's a very important question. As Martin talked about, well, should we do radiation therapy versus surgical therapy? How do we sequence all this? But then, as we don't know a lot about lung cancer, and if somebody progresses and they can be on a clinical trial, will that be safe or not? So we're very involved as a comprehensive cancer center with the NCI in all of those decision making to be able to say, does this clinical trial make sense or not? What is what I said earlier? What is the mitigation plan? Should we halt the clinical trial if it's first in man, or should we continue that? Should we halt the clinical trial even if it's phase 3? How do we come up with all of those strategies? I'm hoping very much that as we open up, but of course, you have to be very careful geographically, where do you open up? And it is important to be able to say, have the institutions, have the physicians, have the healthcare providers work together with patients. I really loved the patient advocacy earlier today too, that you had on, and really work all of us together to say, what is the state-of-the-art therapy that we can still deliver and we can make a huge difference? I've been practicing thoracic oncology for 30 years now, and we've seen so many great things happen for our patients and for our ability to provide supportive care, our ability to provide that targeted therapy or that immune therapy or that innovative radiation therapy or the surgical therapy. And so all of that has to be taken into account, but we should not be fearful. We should be cautious, but I agree, lung cancer cannot wait at all. And come to the people who have that experience, who have that ability to be able to say, let's get through this together, but not be foolish to say, open up everything and then have all of those get-togethers, but to be able to say, how do we prevent any kind of spread of infection, but how do we continue to cure our patients, control the cancer for our patients, and help our patients?
Yes, thank you, Dr. Salgia. I think all well said, and I think my takeaway from you is we should not be fearful, we should be cautious. That should stay kind of our mantra all the way up to, you know, what Dr. Dietrich said, that really until we have a vaccine, you know, there really isn't a mitigation plan outside of truly being able to control this in a way that doesn't allow more and more people to get sick just by way of living. So I thank all three of you. Don't go anywhere. We're going to come back for a robust Q&A session. We've had quite a number, probably the most questions that we've had on any of the town halls. So again, I just think that this speaks to the fact that lung cancer advocates, patients, caregivers are very involved, and they have very specific questions about what this means to them. So I thank you all for joining me. I'm going to ask my team to invite Dr. Haber on from Pfizer. And as we transition, you know, we kicked off this town hall series in talking about colorectal cancer. And we then moved into breast cancer, where we learned from Pfizer early on. You know, it feels like years ago I last spoke with you, Danny, but you know, it really wasn't. It was weeks ago, and this thing is evolving so quickly that it's really, really powerful and amazing to see how industry is evolving quickly with it. You know, normally major corporations like Pfizer that, you know, feel like a massive ship to move are moving so quickly. And I do want to ask you to kind of first introduce yourself, because this is a different group of patients. This is lung cancer patients. We were on with breast cancer patients. Introduce yourself and tell us about your role at Pfizer, and then we'll get into some of the ways Pfizer has evolved to provide services and care during this time.
Thank you so much, Sarah, and good afternoon, everybody. And it's a pleasure to be speaking to all of you this afternoon. And I hope everybody's doing well, staying safe, given the circumstances we're all in. As Sarah mentioned, I'm Danny Haber, and I am the Chief Medical Officer for Pfizer Oncology, and I oversee our oncology medical affairs organization globally.
Thank you, Danny. You know, before I get into Pfizer as an organization, I do want to kind of put you on the spot a little bit. Before we were starting this webinar, you and I were just talking about how we both were coping and had been coping with these changes. And, you know, Pfizer's headquarters are in New York, where it just seemed that this virus took on a life of its own. You and I are both in Florida at this time. But we talked about kind of the mental health impact on each one of us. You obviously lead a massive team of medical innovators at Pfizer. I run a small medical education company, but we both seemed to experience, and I think it's important for the audience to hear how much of a shared experience this was. We both experienced the effects of the shutdown in a way that kind of threw us off our emotional guard. Can you just spend a minute or two talking about how the early part of this affected you?
Oh, absolutely. Thank you so much, Sarah, for the question. I mean, these are unprecedented times for all of us. And, you know, the public health challenges that are posed by COVID-19 have impacted every aspect of our lives. So I personally and my entire organization spend significant amount of their time in their jobs meeting with our healthcare professionals and doing research and making sure that all our patients, particularly in my case, our patients who have cancer, you know, get all the support that they need and all their healthcare providers get all the information that they need to best treat those patients. And of course, because of the situation, you know, we had to first take care of the safety of our employees. So we've asked all our field medical people to be homebound and to really not be too proactive in engaging with healthcare professionals so that we can give them the time that they need to take care of their patients in these very difficult times. So everybody became homebound, including myself. And while we have continued to do the best we can, me and my organization, in managing our day-to-day jobs, however, there was no doubt that we were all feeling the emotional and psychological toll of this. Added to this, that people had to do their job and had their kids at home, they had to do homeschooling. The stress kept increasing and increasing, and we did our best, to keep managing, because at the end of the day, we are all in it together. We know that there's gonna be a solution at the end of the tunnel. And until then, we have to, contribute the best we can to not strain the healthcare system, as we all were talking about it. So being bound at home, having to do the job, and having to deal with all the stress and anxiety definitely affected all of us. But I personally feel today very hopeful that, through this resilience that we've seen and through this collective efforts, then things are gonna come to an end, hopefully very soon. But until then, we need to continue following the guidances and doing what we need to do to stay safe.
Yes. Thank you, Dave, for sharing that, because I think people maybe sometimes see other people in roles, whether it be like Dr. Kazmi as their doctor, but they don't necessarily see behind her white coat is she's a mom and she's a wife and she's experiencing things that, are causing her emotions. Same with you, Chief Medical Officer of, a very impactful organization. You've got to be strong for everyone who's under you. But at the same time, behind your jacket, there's a human that's experiencing this thing that, is so different than anything we've ever experienced. So, we learned that Pfizer very quickly developed, this 5-point plan. As big organizations do, you've got to move with big things. And so you developed this plan and you started going, and, this was a couple of weeks ago, you laid out the beginnings of it and how you were pivoting as a company. Talk to me about how you've evolved and what things maybe you measure as successes at this point.
Yeah, so, we at Pfizer realized from very early on that no one company or, healthcare organization can win this battle alone. So we outlined, as you mentioned, a 5-point plan as a call to action across our industry for a new level of collaboration to combat COVID-19. The goal was to connect all members of the innovation ecosystem to work together to help rapidly bring forward therapies and a vaccine. As mentioned earlier, this is going to be the most critical milestone that hopefully will help us control this. And we also have to prepare for, the future to better respond to similar challenges. So this 5-point plan consisted of, one, our commitment as a company to sharing our tools and insights. People mentioned significantly that, this is a disease where we're learning by the day. And we as a company have a lot going on, and we want to share every learning that we have on the virus with whoever can make something out of it, making them available on an open source platform for the broader community. The second part of the plan was about marshaling our people. Pfizer employs leading virologists and biologists and clinicians and vaccine experts, you name it. And these people were tasked to solely focus on addressing the pandemic internally. We also recognize that there are some other companies that may bring forward, smaller companies may bring forward, some promising candidates, but they may not have the development and expertise machine that we have at Pfizer. So we committed to making and sharing our expertise and development for those companies if they need to. We also committed to offering our excess manufacturing capacity to other companies also who can bring forward a potential therapy or COVID-19 vaccine to bring it as fast as possible to the hands of patients. And lastly, the fifth aspect of the 5-point plan was about our commitment to improving future rapid response by partnering with federal agencies such as the NIH and CDC to create really a cross-industry rapid response team. So these were the 5-point plans that, that were set forward very early in March, and we're fully committed and stand behind it. Now on the specifics, what Pfizer is doing, and I think this is very interesting for a lot of people on the call, we focused, of course, initially, as I mentioned, on the priority of our people, safety of our people, and ensuring that the supply of our medicine and vaccines to patients continue without interruption around the world. And the most important is a priority that we've set forward, which is to develop a solution to the pandemic. And we are making great progress. I'm happy to share, if you're interested, where we are in the development of a vaccine and the development of therapies.
Yeah, I mean, Danny, I think, it's worth sharing a little bit about that because, again, there is so much misinformation. There is so much, confusion. We still don't even have standard testing, widespread testing. They talk about contact tracing. None of these things are really well or robustly available. So I'd love if you just took a minute or two to talk about, where you are in vaccine development.
Yeah, I mean, I think no two people disagree that the optimal solution for this pandemic is going to be the availability of a vaccine. We've announced recently that we've entered into a global collaboration with a German biotech called BioNTech to co-develop a potential messenger RNA-based coronavirus vaccine. We already were in talks with BioNTech to develop a flu vaccine. So because of that collaboration was very well expedited. And in less than 4 months, which are timelines that are basically unheard of in the development of vaccine, the two companies moved from preclinical testing to a phase 1/2 clinical trial. And last week, we enrolled the first participants in the United States, in New York and in Maryland. And of course, there are many sites around. And the week before, we enrolled also patients in Germany. At the same time, we are moving at risk to actively scale up our capacity of manufacturing in parallel with the development of the vaccine, which normally you do it sequentially, because we really don't know if the vaccine would work, but we are hopeful that it's gonna work, and because we cannot wait until this particular milestone to start developing, we're moving at risk with upscaling all the manufacturing and distribution capacity.
Yes, I mean, it's just incredible. I have to say it's incredible. You think about these, giant organizations, pharmaceutical companies, and traditionally, they kind of have their marketing perspectives in all the different disease types that they serve. But to see how so many companies have come together alongside regulatory agencies, kind of health, federal level health information organizations, it is just, it's humbling and it's exciting, and it really just restores any thought that you might have that, nobody's really taking charge of this. There are people taking charge of this, and, they're working tirelessly in labs everywhere to try to come up with viable solutions. So stick around, Danny. I know there's going to be a lot of questions. You used the word vaccine right away. I'm sure 100 people joined to hear more. So stick around. I'm going to ask my team to transition to Randy because, really you can't do a patient advocacy webinar and program without having a patient perspective. So as we get Randy on, I also want to say, we've been doing so many of these virtual town halls in different disease types, and there are ways that industry, I have an example, a company that produces liquid biopsies, a company called Guardant Health, that really revolutionized the way we looked at next generation sequencing, which is, kind of the way you type a cancer in layman's terms. You look at the behavior of the disease that gives doctors clues on how you would respond to various treatments. You know, Guardant Health, who's a leader in liquid biopsy, almost immediately developed ways that they could bring their blood testing to the homes of patients that were either feeling worried or that were put on different treatment schedules or different clinic visit schedules. So, you know, you just look at these companies and you look at the way that they react to this emerging virus, and you know, it makes you proud to be part of the cancer community. Randy, thank you so much for joining us. These have been my favorite parts of all of these webinars because I was recently diagnosed with something last year. And, you know, when I started tapping into patient chat rooms and message boards, it changed my life because I thought to myself, I'm not alone. Oh my goodness, this person might as well be telling my story. I could ask questions to people who were further along in the disease than I was. So I thank you so much for being with us and sharing a little bit about you. So maybe you can start with, you know, your journey through cancer, your diagnosis, and where you are currently.
Okay. Well, thank you. As you say, I guess it's always good to save the best for last, right? Anyway, 12 years ago, last month, I went to bed one night, just like any other night, other than I had this nagging cough. And the next morning I woke up coughing up blood and obviously knew something was amiss. So immediately went to the doctor, and within a week's time, I was diagnosed with stage 3 non-small cell lung cancer. Needless to say, at 52, that was a bit of a shock and caught me completely off guard, as I was a fairly low risk, as they would say, individual. No history in our family. So it just really kind of came out of nowhere, and I was running a small business at the time and had 2 teenage kids, so it was kind of a life-changing moment in my life. I actually fired my first oncology team. I was diagnosed at a regional hospital, and it was apparent in about the first 3 or 4 meetings that they were not going to be the right fit. I won't elaborate, but it was a very fortuitous thing for me, because I could almost guarantee, had I not changed my course, you would have a different patient on here today. So I did. I went out and actually shopped, and I was fortunate enough to land at Seattle Cancer Care Alliance here in Seattle, and have one of the most renowned thoracic oncologists that I've ever, you know, been told and that I've experienced. And he's still my oncologist today, and we are in fairly steady contact. We talked about teledocking. I've been having some challenges with some wheezing and some coughing, and so obviously with what's going on in the world today, wanted to take some precautions, and he immediately recommended that I get in and get checked. And I have been checked twice in the last 2 months, and both times it has come back negative. And I am better, and they did put me on an antibiotic, and so I am improving. But it's been pretty interesting time, to say the least. And it has not been a joyous ride in that regard, but like I say, I am improving. And you know, when I see the people on TV or talk to some of the people, I have a close friend in in New Jersey, whose husband is on a ventilator in the hospital and been getting her daily feeds. I could almost, I mean, again, with having the lungs that I've got and hearing what he's going through, I cannot even imagine what that would be like, being a lung cancer prior patient or current patient, and going through this at the same time. It would, I can understand why they say that, you know, people that have compromised lungs are at very high risk, and that would be probably putting it mildly. So the bottom line is I'm doing good, and I do a lot of patient advocacy work. I've known Katie for, my gosh, 10 years, I think, when I was introduced to LUNGivity back then. And I do, like I say, I do quite a bit of I'm kind of a cancer lightning rod, if you will. If somebody knows anybody that gets diagnosed, I get an email or a phone call, and doesn't matter what kind of cancer. I try to guide them and help them with communicating specifically with their team, because a lot of times, especially early on, people just really don't know what questions to ask, or are overwhelmed with what they're hearing, and are hearing bits and pieces of what their team might be saying. So that's been a real big focus of mine over the last few years. And there you have it. Is there anything else that if I've left anything out, let me know.
I feel like I, again, could have, a 2-hour town hall with just you. Randy, we sit and think about how each one of us have kind of come to the recognition that this is a new time, and for a lot of us, it's a dangerous time, just because of the level of risk that we may have. Even though, for the most part, you can say categories of people are affected differently, but you hear about, marathon runners that end up on ventilators. So this disease doesn't really discriminate based on any very secure set of criteria. What would you say to patients listening right now about how you plan on phasing in, kind of opening up back to whatever we are going to be calling normal in the future?
Well, that's a tough question. I'm really holed up. Like I say, I just can't even begin to run the risk of getting exposed to this. I actually did go for a walk yesterday and sat in the park and stayed 6 feet away from just about anybody, obviously, and I wore a mask most of the time. But, to one of the doctors saying, we will get through this, but it's anybody's guess as to when that might be. And, it depends on who you want to listen to. Could be 6 months, could be a year, who knows? So I'm fortunate. I work out of my house, and I stay fairly sequestered, and a very limited amount of people come in, and so my exposure level is low. And I've got a great network of people that a lot of them go shopping for me. So I try to, again, avoid the crowds. So, but you can't emphasize it enough. As anybody that's got any kind of cancer, that you do not want to add this to that list, believe me. So, you've got to be precautious and do everything you can to, I wash my hands so much every day that, when I go to the bathroom, I don't even have to clean the toilet. Yeah. So.
Randy, you mentioned early about, going to see your treatment team and then realizing that they're not a good fit. There's this, overwhelming philosophy that when you go and see a healthcare provider, it's kind of like, okay, now you're a lifelong team. A lot of times, especially when you're in such a vulnerable state of mind, and you're receiving new information, overwhelming information, that you don't necessarily think with that critical mind that you would have had if you were a caregiver along for the ride. How did you come to the point where you said, this isn't right for me, and maybe even more importantly, to make immediate changes to the team, especially since you believe so strongly that the outcome would have been so different?
Well, it was kind of a strike three situation. I went to, like I say, my normal doctor, if you will. That's where I was, quote unquote, went to when I coughed up blood. She sent me up to a pulmonologist, and he looked at my x-ray, and at the end of it, he says, I think you've got a mild case of pneumonia. Wow. And I said, really? And he says, yeah. He says, and he goes, I could do a bronchoscopy. And he says, he says, you might have lung cancer. But again, because I was such low risk, and he just almost ruled it out. And so he said, you don't want to have people just willy-nilly going in and doing bronchoscopies because we can introduce things. So I said, if I was your son, what would you do? He said, go home. He said, but if you cough up more blood, come back and we'll do it. Well, 4 days later, I coughed up more blood. So I went back in, and he did the bronchoscopy, told me at the end of it that he found a mass. Come back on Monday and, we'll let you know the results. Come back on Monday, and he says, you have lung cancer. It is malignant. We found a mass, and you don't need me anymore. You need a oncologist. And I wouldn't wait too long to find one. And he reached over, shook my hand, and said, I've got a tea time in an hour. Good luck. And he walked out of the room. And so in that moment, obviously my life was changed. And all I could think about was my 2 kids. So I went back downstairs and talked to my primary, and she told me what a great team they would have, and that, she was going to introduce me to the thoracic oncologist, which she did. And I met him a couple days later, and I was in the lobby, and he just came out, and he had his, reflector and a stethoscope and white coat, and just stood there and told me what I had and how he was going to open up my lungs and remove, and then I was going to have chemo, and I was going to have radiation, on and on and on, and then turned around and left. And that was 5 minutes of his conversation. But he said, and then he comes back and he goes, but I'd like you to meet the surgeon. So I went upstairs to meet the surgeon, which was, again, a different appointment. And this time I thought enough to bring somebody with me so that I had an extra pair of ears. And we went in and we sat down, and anyway, we were sitting there, and he had not even looked at my chart, because he goes, well, I think you might be stage 3 or possibly stage 4. But I've got to look a little bit closer yet. And he says, but I'm going to go in and I'm going to resect your lung and take it out and this and that and the next thing. And, by now I knew the difference between stage 3 and stage 4. Well, I remember sitting there and I started to cry. And he just kind of said, oh, there's Kleenex behind you, go, and then there's all of a sudden his cell phone went off, rang. He goes, oh, hang on, I got to take this. And it was his wife who was giving him instructions on what to stop and get for dinner, because they were going to have a barbecue. And I just remember sitting there, and I was looking at my friend, and I went, wow, this is just too weird. And so then he comes back and he says, now where was I? And he starts talking again. And then the phone rang again. And he goes, oh, stop, I gotta take this call too. This was somebody up in Alaska. And I remember looking at Liam, and I said, I can't do this. I gotta go. And so we got up and started, and he goes, wait a minute, we're not done. And I said, I am. And I left. And that's when I realized, I thought, wow, okay, I have to really go shop. And unfortunately, there's not a Yelp for thoracic oncologists, and I didn't even know what a lung cancer advocacy group was at the time. I didn't know any of this stuff. So anyway, like I said, I fired him. And it's funny because Katie's on here, and Katie asked me to come and speak at the second one of their Hope Summits. This was many, many, many years ago when I shared that story, and I told the team, there were, I think, 60 people in the room. And at the intermission, I would say half of them came up to me and said, it never ever dawned on me that I could fire my oncology team.
That's why I asked you the question, Randy, because even though I've cut into the Q&A, again, as a patient myself, and really that these webinars are designed to be, patient to patient. That's such an important decision that we own. We own that decision.
Right.
And, for my experience, I had to go through almost a dozen doctors to even get a diagnosis, because what I have is so unique and it's so written off by the general practitioner community. So I know that your story has touched someone very deeply right now, who has been saying, largely the same thing. Like, why does it feel that, I have to be here and I don't feel like I trust this environment? Well, then we're empowering you in this moment to get out of that environment and seek an environment that feels safe and that feels like it's going to help you.
I can't emphasize it enough. It's probably one of the most important decisions you'll probably make in your life.
Absolutely. Raina, if you would bring up everybody else to get into the Q&A, you know, we may have Randy. I'm sure that there'll be people that are waiting to ask him even more questions. You know, this is, again, it's a difficult time for everyone with COVID-19. It has been a difficult time for people who have been diagnosed with or living with cancer, caring for people with cancer in any stage. And so, you know, the fact that we could all get together as different communities, all with the same aim, I'm telling you, for my perspective, having run, I can't even describe to you, hundreds of programs in medical education in my lifetime, these town halls have been the most powerful and significant things I've ever done. So I'm grateful to COVID-19 for providing the environment for which we can do this. So I'm going to get into some of the Q&As. I want to again thank everybody for your contributions today so far. And we're just going to go through some of the questions on the Q&A board. You know, there are a lot. Oh, this is one that I think is so sweet. So someone said, "You're a great mom, Dr. Kazmi. What are your plans with letting your kids go back to school as they open up?" And everyone, we've got about 12-ish minutes or so, so let's keep in mind. But I love that, Doc. I thought you would get a kick out of that too. You're a great mom, which you are.
I had to unmute myself. Thank you so much. That is so sweet. And really, I think we're all just trying to do our best. There are great moms in here. There's great dads in here. Let's not forget that they're doing a lot as well in a different circumstance. And children themselves have been resilient. Grandparents, everyone's contributing. What am I going to do? You know, I'm trying to take it day by day, days, weeks at a time, and keeping in mind that schools may not open in the fall. I think the decision for me, if they don't open in the fall, is going to be easy, right? I have nowhere to send them. They're going to be home. If they do open and I particularly feel uncomfortable in the way they're taking precautions, that's a different scenario. So I think that that decision needs to wait. I think adding additional anxiety and concerns about the things that might happen in September, I think it just creates a negative feeling in a very uncertain environment. So let's kind of deal with the today, and let's deal with this week. I mean, things that 2 months ago, we didn't have this. And now here we are. So I think 2 months from now, we'll be in a different situation. So I'm not trying not to worry about everything at the same time, one step at a time.
Yes, thank you. Dr. Dietrich, are you routinely testing patients for COVID before starting chemotherapy?
Yes, we do. It has been a protocol for us. And to be honest with you, I don't really know what to do with the results. I'll give you an example. I had a small cell lung cancer patient that was symptomatic with a positive COVID-19 test and no relatable symptoms. That's a big, big dilemma. Obviously, there is a concern that we cause immunosuppression, aggravation of the virus. But then it's not necessarily only the viral infection, but the autoimmune-induced hyperinflammatory state that's affecting the lung and other organ systems that may cause that problem. So I'm not sure if I'm actually making it better, worse, or keep it the same. So I'm not necessarily sure. We're testing pretty much everybody. We've ramped up dramatic capacity in Florida. So this went from 0 to 100 in a matter of a few weeks. But I don't really withhold therapy. It does influence my therapy choices. Oftentimes, if I have different opportunities, I like to avoid the immunosuppressants because I think that palpable immune system is the most important factor. When we do test, we capture that data also for learning. We're utilizing it for obviously isolation. We give chemotherapy to patients that test positive and that require chemotherapy in the hospital in a negative pressure isolation room, so they don't get exposed or they don't pose a risk to our other patients. So we try to be sensible, but again, even though this feels like we've been in COVID forever, it's only been a few weeks, and there's so much that I don't know that I really have to ask my patients and myself for patience and forgiveness that we're operating sometimes a little bit without guidance and data to back us up. And said, when I have a lung cancer patient, they are a medical emergency in the higher stages, or at least a medical urgency. And I do try to not overemphasize the impact of COVID-19 and de-emphasize lung cancer, but try to balance them in a reasonable way.
Yes,
But
yes.
at least for the.
I think that it's really important too to people that, they know that, the hospital systems are considering not just the patient's state of being positive with COVID-19, but the provider, that you now may be exposed, and then you expose all the other vulnerable patients and their families that are coming after. So thank you, Dr. Dietrich, for letting us know this is what's happening. Danny, as expected, I think I'm just going to sum up in one major question that I think is shared by everybody, including patients that are not living with cancer. This idea that we could accelerate vaccine development in a safe environment. There's still, even before this was kind of like the anti-vaxxers community that said we shouldn't even be taking other types of vaccines. So now we've got this added layer of, is this first vaccine going to be safe? Should I wait to take it if it does come out? What would you say from a medical perspective to people who are asking that very serious question?
I think this is a very important question, and many companies are actually working on vaccine development. I think there are few already in the clinical setting, including the one from Pfizer and BioNTech. And although the technology that is being followed, and I'm not a vaccine expert, but I got to learn a little bit about it given my role. The technology being a messenger RNA vaccine candidate, the one we have, allows for a faster development. However, none of the important steps of robust clinical testing are gonna be burned or shaved, because this is critical to establish the benefit risk of the vaccine. And I think health authorities, will ensure that any vaccine that gets approved has the right evidence of, favorable benefit risk behind it. So I wouldn't worry about it today, because I think all the companies that are developing vaccines, and also many of them in collaboration with academia and with small biotechs, are, I would believe, doing it the right way. And hence the vaccine that gets approved, hopefully more than one, will have the right profile that would be safe for patients.
Yeah, no, and I appreciate that. And I think that goes back to Dr. Kazmi's statement earlier, living in this pandemic of misinformation. There are so many people that have all these conspiracy theories about, profitability behind vaccines and just all of these things that you sit there and go, what? So I'm grateful that, you shed a light on, there are no shortcuts being taken, just because we're accelerating, we're really accelerating processes in a way that, provide a safe environment to do so. And there would never be a situation where any company would irresponsibly develop something for, a larger population. So
it's not about profitability at this stage at all. I think it's about, saving lives, and the profits maybe one day, if that becomes, a seasonal thing, because we really don't know, could be there. But in the immediate pandemic, I think profitability is on the side, at least for Pfizer.
Yeah, it's really restoration of life as we can live it. Annette, I'm going to ask you, because you really represent, the American Lung Association in this wide capacity. Masks, there's so much information about what kind of mask, when, how, should we be using, how are we making these home masks, fabric masks? Do they protect me or do they protect the person that I'm talking with? What's the American Lung Association's position on informing the public on the use of masks as we get through this?
Thank you, Sarah. I mean, I think we definitely mirror what the the CDC recommends. I mean, this is definitely, we don't have, our position is based off of what the federal guidelines are recommending. So, we support what is being offered. I mean, most certainly masks are to protect, not to protect you as much as to protect, other people from what you may potentially, have. But this is definitely, our position is most certainly in guidance with the CDC recommends.
Thank you for that. And again, keep coming back to this misinformation. Look for reliable sources. Log on to LUNGivity. Get involved with Inspire. Look to the American Lung Association for guidance. Organizations like Pfizer have resources that are specific to COVID-19 that are not specific to Pfizer, but that are very responsibly vetted by people that are qualified to be making these recommendations. So please, as a patient on the outside, don't look to social media, what your neighbor said, what someone shared, what someone private messaged you. Try to find opportunities, and here are great ones to really get credible information. Randy, I also knew that your story would resonate with this community. So the question here, how, you mentioned there's no Yelp for cancer treatment, which, is a great opportunity if anybody's listening, we should develop some kind of Yelp for cancer treatment. But how did you do your research for where to go once you decided and determined where you were or didn't fit? Randy, would you unmute yourself? So sorry. That's a common Zoom thing.
Yeah, I used a variety. I mean, I reached out to my network, and unfortunately, again, like with lung cancer, especially 12 years ago, it's not like there were a lot of survivors, so there weren't a lot of pre-patients, if you will, that you could use as a network resource. But I spoke to a couple of different cancer patients who enlightened me on the difference between regional hospitals and academia cancer treatment. And so that started to make sense and resonated. And right here, fortunately, in our backyard, we have the Fred Hutch Cancer Research Center, and we also have Seattle Cancer Care Alliance. Swedish is a good one. And I went to all of them and I interviewed these doctors. And so the third one, I remember, and again, each one of these visits, I took a friend with me. And I remember when I met with Renato, he was the doctor Renato Martins at Seattle Cancer Care Alliance. He spent an hour with us and he walked us through from start to finish. And I remember at the end of it, and he says, are there any questions that you might have? And I said, the only questions I have are the ones I don't know to ask. He says, that's a good question. And he said, and that's why I'm here, and I'm going to answer these for you throughout the journey. But he goes, I'm going to treat you with an intent to cure, which at the time I thought, as opposed to what? But, so that kind of threw me. But I remember when he left the room, my friend just said, you don't need to look any further. This is your guy. Fantastic. And I didn't need that affirmation, but it helped because I had already made up my mind as well. And he's just been a phenomenal care provider. Katie knows him. I've recommended numerous patients to him. No one has ever gone to look for somebody else after they meet with him. And he's got an amazing record. So, and I'm living proof. So it is, again, the importance of finding that fit and making sure that you get the person that knows what they're doing and then knows how to communicate effectively with you. And I just cannot emphasize that enough.
Yeah, your life depends on it. So I really do appreciate your story. We're a couple minutes over, but I never end one of these webinars without trying to be a little bit lighthearted. We're dealing with a difficult situation emotionally as a global community. Lung cancer in itself is a difficult topic to talk through. So I always like to kind of humanize everybody on the panel. I would like to say, just to add on to what Randy was saying about doctors, I've had the pleasure of working with Shane Robbie and Martin for years now, and I find them to fit the description of what Randy was saying. I've sent people for different types of cancers to different types of physicians, and sometimes you just get to understand how much passion and how much brilliance comes with some of these doctors. And I have to say that the three that we have on this webinar today really exemplify doctors that spend the time necessary to go through your situation, your disease, the comorbidities, the treatment plan, everything in a way that makes sense to you, taking as long as it needs. So I do thank the doctors on this call for taking the time here too. So let's end with something light. I'm going to put Martin on the spot first, probably because even though we're closest geographically, there's nothing he can do about me putting him on the spot first. Martin, what is your hope for what you will come out of COVID-19 with? We have people that are learning new skills, languages, they're reading books, they've started yoga, all kinds of things. What about Martin Dietrich? What are you coming out from this with?
Well, I do think that there's a great learning opportunity here. I do think that it really helps us dissect what's important, what's not important in many ways. It really puts on the spot everything that we've done. I really thought COVID is just going to be a challenge, but it's also a huge opportunity. Protocols that we've been doing for the longest time, never questioned because we've always done it that way. All of a sudden, we see that we can integrate new technologies, new protocols into patient enrollment for clinical trials. They don't have to travel 1,000 miles to find out they're not eligible. They can be screened by telemedicine. I think the acceleration of protocols. I think there's always a chance in a crisis. I think the original definition as a crisis, as a decision-making point rather than a low point, is really my optimistic approach. And I realized what's important for me, my family, my friends, their well-being, their health, and the things that don't really matter as much. And as much as we grieve about certain things that we're missing, I do think in the end, the essence from the non-essentials are being nicely separated. And then I'm grasping onto hope. In our lung cancer community, we've seen two things that I thought were fantastic and that have really inspired me. One is, and this is particular for the American Lung Association, we've seen a smog-free skyline in Orlando for the first time since I've been here. And this is for many cities in the country. We have clean air. We have Los Angeles is seeing the mountains. And this is globally, China, India, Germany. You see all of a sudden one of the biggest predisposing factors for lung disease clearing up. Maybe we can learn from this. And the other one is, in the last 2 weeks, we had 3 chemotherapy-free approvals for lung cancer, driving our things forward. I think every single one of them will be a game changer for patients, for red met and PD-L1 positive disease with combination immunotherapy finally arriving. I said I do see the positive in this, and I really try to take my life a little bit more philosophical and spiritual than I did before the crisis, where minor things have been aggravating me.
Yes, thank you, Martin. And I do want to say to the viewing audience who have been with my town halls in the past, where it is very lighthearted, I've known Martin for years, and he's one of the most brilliant doctors. He's an MD, PhD, very analytical, very strategic. So I can imagine when I ask for something like, Martin, are you starting yoga? He goes into philosophical answer of all the wonderful things that can be changed in the lung cancer community. So I'm going to answer that I've seen a lot more posts on social media from him with him and his pup at the beach. So I know that he's spending a lot more time outside with his man's best friend.
Distancing, I have to add.
Yes, yes, with distancing, yes. So, and that to that point, this is a personal question of what you're taking out of this. What will the post-COVID Annette have as a skill that the pre-COVID Annette did not have?
Well, I have 2 daughters, and my oldest daughter graduated from Penn State University virtually last weekend. And, you know, I think it does. It's a family focus. I think that we all felt we were, you know, as a family, you're very close and you do a lot of things together. And it just has brought us full circle. I feel like they're small girls again, that my husband and I, you know, playing the games that we didn't play before, and you know, not using as much of where are we going or what are we doing. It's 3-hour walks as a family. So it's amazing. That perspective is amazing. And I think, you know, for my daughter and all of those high school seniors or college seniors, you know, it is a disappointment, but there are so much of a future opportunity for them that this is just one step of one disappointment that you have to move past, because it's not the end. And you will appreciate the hugs and the smiles and the conversations when the time comes that we're ready to do that.
Yes, and how many high school, college, even 5th grade, kindergarten graduates can say that their graduation was interrupted by a global pandemic? They'll have a story for the rest of their life on the impact of this moment in time on us. Dr. Salgia, what did the pre-COVID Ravi not have that the post-COVID Ravi will have?
So, you know, Sarah, thank you again for hosting this and for everyone to join this. And, you know, I've always taken the approach, we're a family. We're a family together, the immediate family, but also our neighbors, our friends, our patients, and throughout the world. And what it really has taught me even more is to be able to get together more and appreciate each other more. And we're not as busy, as we are not traveling as much. We can do all of our meetings by Zoom, so that way you're not wasting time going from one place to another. And really appreciating the concept that you can actually get together and enjoy, and also spread the joy as well. And one of the biggest challenges and one of the biggest things that we know is that if we don't appreciate each other, we're not going to appreciate anyone else. And so I really am thankful. Unfortunately, it's a crisis, but I'm thankful for spending that time together.
Yes, thank you. Katie, pre-COVID Katie to post-COVID Katie, what are you coming out with?
You know, I have to appreciate what the other speakers said about being just so incredibly focused and busy and traveling so often. I feel like I was always in a rush, and now I can pause and take that moment, you know, with my family, with, you know, nowhere to go and nowhere to be, and to just really appreciate those around us and take the time to really, you know, connect with other people when you can. Technology is fantastic. Zoom calls where you can still wear your PJ pants. And if you have a dog, remove the squeaky toys before your conference calls.
Yes, agree. Thank you, Katie, too, for the practical takeaways for Zoom etiquette. Danny, what about you? Pre-COVID, Danny, to post.
Two things. First, you know, before COVID, I was living my life almost always on a treadmill, because, you know, I would be flying in the morning, and then in the evening I'm in a different city, and I would be like grabbing, you know, now I'm learning, you know, to still do a lot of effective work by, you know, taking it a little bit more, you know, in a relaxed way. The other thing is to really enhance a little bit more my cooking skills, because, you know, we haven't been eating out. I don't trust any of how people are preparing the cook to order delivery. So I have to do everything at home, and I'm a good cook, but then, you know, now that you have all the time and you're watching the cooking channels all the time, I've spent a lot of time perfectioning those. So I'm going to be a better cook after COVID than before COVID.
So we're going to see Danny Hubbard's CMO of Pfizer on one of the upcoming Chopped.
I hope so.
Got it. I'll make sure that I call in my vote. Randy, what about you? Pre-COVID Randy to post-COVID Randy?
Well, I want to share one real quick story, because I think this is really important, especially with all the doctors that we have on this and any that might actually possibly be out there listening. On my 10-year anniversary, which was a couple of years ago, I went into the doctor to get checked, and you know, the CT scan, blood, all the good stuff. And I actually met with a fellow and to begin with. He started the meeting, and when I came in and he looked at my chart, he goes, "Wow, we don't see very many of you." And I said, "Yeah, I get it." And Renato came in, and he said, "Everything looks great." And then he left the room first, and I finished up with the fellow, and then I stepped out. And as I walked out into the hall, Renato was literally skipping down the hall and sticking his head in every room going, "We have a 10-year survivor in the house, 10-year survivor in the house." And he did this the whole way down, you know, without knowing that I was listening or watching. And in that moment, and believe me, I had never really given it too much thought. I hadn't thought too much about his world. Every time I came in there, I always thought only about mine and what he was going to say to me and what I could possibly get or hear. And, you know, there was always scanxiety and all that good stuff. But in that moment, and I share this because I think this is a post-COVID moment, is that doctors are people too. And a lot of times I think we forget that. It really hit me, and it made a huge impression. And again, it's one of the reasons why I care for him and that team as much as I do. And I want to thank all the doctors on this call for all that you guys do and for all of them that are out there, because it's nothing less than miraculous.
Randy, thank you so much for that story. I know that it will touch a lot of people. Shema, I don't know how you follow that. I really don't, but what about the COVID, Shema, to the post?
Gosh, thank you, Randy. I have to say, thank you for sharing your story. It really touched us, but you're right, we're human and we're not perfect. And it really is good to hear your great story. And thank you so much, Sarah and Raina and Dalen, for arranging this. So really, I'm gonna just summarize what everybody else already said. I'm being more of a human being than a human doing. I mean, I think we're finally just being instead of constantly doing. And I love that, because it's the post-COVID, there's no post-COVID. I think it's gonna be living with COVID, but I'm a better cook. I don't know about going up against Danny on Chopped, but as long as my kids finish the plates, I'm happy. That's success to me. So better, more cooking, and just actually being able to not feel guilty, sitting on the couch and maybe binge watching a few Netflix shows. You know what? The guilt factor has dropped significantly. I'm trying to relax more, and it's okay.
Yes.
So let's take that.
This virus has reset everybody, and it really is our decision to decide, you know, how we're going to be reset. So I thank you all so much. Randy, I think that your story and you are the reason that we do things like this. You know, we want patients to feel connected, supported, heard. We want them to know that there is a whole community of others out there that are either going through disease or invested in treatment or policy or drug development. You know, there's a community behind them. So I celebrate with your doctors, not just your 10 years, but now your 12 years and hopefully your 20 years when we come back for a reprise. So I thank you. I thank every single one of you for being on this town hall. It matters. I can tell you firsthand, it matters. I will share with you all week as I get emails, text messages, Facebook messages on how much this has meant to people. You know, advocates, we're behind you. Doctors, we're praying for you. Danny, we're lifting up Pfizer and all the other organizations too, like Guardant Health, that are invested in making things more accessible. For what you do for cancer patients today and for what you're doing for the future in cancer treatment and the community. So we thank you. We honor all of you for what you're doing, and we look forward to a time where we can gather together. Have a wonderful rest of your Saturday.
Thank you.
Bye-bye.